We are live. Hi everyone, I'm Megan, Bariatric Dietitian, and we have Michael here, Bariatric Surgeon, and today we have our nurse Jessie joining us as well for our Friday lunchtime live, and we are on our Instagram page and also our private Facebook group to hopefully reach a lot of our patients to chat today about weight loss trajectory after weight loss surgery. So yeah, feel free to jump on and ask some questions as we're going through, but we'll kind of just chat through some points we thought might be interesting for you guys to hear about, and that often comes up in our appointments with patients. So yeah, to start us off, Michael, what would you, I guess, say the average weight loss is depending on which surgery a patient has after surgery?
Good question. Sorry, I just put my thoughts together. So look, that's a good question, isn't it? And I guess that's probably really the big thing that people are thinking about when they have surgery, what they're going to get to, what life's going to look like. So just looking at a purely weight perspective, I guess what we focus on is a thing called excess weight. And excess weight is how much your weight differs from what would be considered average someone of your height. So for example, if you're 100 kilograms and you're about 180 centimetres, your excess weight might be 10 to 15 kilograms. And we use this because weight loss surgery sort of helps you lose a percentage of that excess weight, but probably not all of it. We can go into the reasons for that kind of later, but on average with a sleeve, you might be looking to lose about 70% of your excess weight, and with a bypass, maybe up to 80%. So that's what we would work with. I guess the first thing I'll say is a lot of people come in and they want to sort of reach a normal BMI as their target.
Yeah.
So we should talk about what BMI actually means and why that's not going to be really so relevant to this group. Yeah. And you guys talk about lines.
Well, yeah, BMI is a tough one. It's got a lot to answer for. I mean, certainly it's a number, but it doesn't take anything else into account. And very often, yeah, people have that idea of wanting to get to a BMI of, say, 25, for example, because they think, oh, well, on the chart, that's where it says I should be. But it doesn't take anything into account. It doesn't take age, sex, ethnicity, muscle, absolutely. Lots of athletes wouldn't be in a normal BMI for that muscle. So,
do you guys know how they came up with those BMI numbers?
No.
So originally it was based on the average weights in the population, and it was sort of based on the community in New York. So the New York Metropolitan Life Tables, an insurance company that developed this number to try and use the equation to stratify insurance risk. So it was actually just the average of the population at that time. So actually it's not even actually based on health.
Yeah, right.
And then it sort of turns out that there's kind of a relationship between that number and your health and longevity, but it's not a very strong relationship. So it's kind of a rough measure, and I guess it's maybe like one tiny step better than just using pure weight alone because it incorporates height, but that's about it.
Interesting. What year was that, I wonder?
It's like 1960.
Yeah, right. Okay. Interesting. Yeah, I never knew that.
Yeah, I'll often tell people that BMI is more a way to group. Like it's more of a population measure.
Yeah.
Like it's not based on individuals, and it doesn't actually show if a person can improve their health after surgery. Like we're not kind of aiming for the BMI for that to be an indication of change and improvement in quality of life as well. Yeah.
That's actually a really good point. Yeah, it is really good for populations because you sort of wash out all the differences. That's a good point.
Yeah. So I think like I often will talk to patients in my first consult about their goals, and like it is always, you know, a bit of a conversation about weight goals, and hopefully at that point they have had an appointment with their surgeon and kind of had that conversation around what their average weight loss would be and what like a realistic expectation would be for their weight, but then also trying to get them to have a think about like non-weight goals as well. or like quality of life changes that you can actually reflect on and see that difference more than just the scales too. So yeah, that's often something, moving away from just looking at weight as like your
And the numbers.
way to kind of measure your health outcomes after surgery, because there's a lot of other things or a lot of other conditions that people have when they come in for surgery where you could be looking at changes in health markers as well.
Yeah, absolutely. And sometimes people can have a particular number in mind, and often it's based on BMI, often it might be based on the weight that they had at some point in their life when they were obviously a lot younger as well. And then I guess it's about asking that question, well, what actually changes with now, you know, in terms of your quality of life if you do achieve that number? And the answer is not too much.
Yeah.
So Jessie, how long does it take to lose weight after weight loss surgery?
So it depends on quite a few things, depends on the surgery type. I often find that the bypasses tend to lose weight a little bit more quickly. Do you find the same?
Yeah, a little bit.
Yeah. So from the look, some people have kind of reached their maintenance weight by as soon as about 6 months. Other people are still trickling down in terms of like slow and steady weight loss after the year mark, even up to 18 months.
Yep.
Sometimes I would say,
Yeah, I agree. I think there is always kind of two variations in patients. Like you'll see sometimes that faster weight loss trend and then the weight plateaus early at their stable weight, or like a longer weight loss that's a bit slower. Is there anything that shows why that happens, Michael?
Look, we don't know precisely, but you know, most of the weight loss after weight loss surgery is driven by hormonal receding, and the body really trying to work to a new, ideally healthier weight. And we don't know why in some people that sort of seems to come off really quickly, and the body kind of wants to get to that new range almost in a hurry.
Yeah.
And some people do take that 12 to 18 months. It's an interesting thing. And so short answer is no.
Yeah.
But I think one of that reflecting on that, that's just another marker of how obesity is such a complex bunch of different conditions and how it's really different for different people.
Yeah.
And I guess that's why, you know, things like surgery or drugs or dieting and exercise, all the things we use has different variable response for different people.
absolutely. And when you look at the data in terms of what's normal in terms of weight loss after this these type of surgeries, it varies significantly. Yeah, it's very difficult to predict, I suppose.
I guess one common question I get is, you guys probably get this question as well, but you know, people always say, you know, is it possible to not lose weight or failed surgery because they've done lots of diets and you haven't been so successful? So, what do you guys say about that?
I say that pretty much everyone will lose weight with surgery. Like it's pretty much impossible to not have some weight loss after surgery. I guess it's more about the like amount of weight loss and then also the weight maintenance long term that can vary depending on a lot of factors. Yeah.
Absolutely. And often that feeling comes from having tried a lot of things in the past. So I think having that reassurance that this time it is different, because instead of your body working against you, it's going to be working with you with those hormonal resets. Yeah. And sometimes it can take a lot of reassurance.
I guess it's theoretically possible though to not lose weight. And I feel like sometimes people are like, really? Like I've done so many things before and it's never worked. Is this really going to work? It's sort of still this disbelief.
Yeah, and I guess that also, I notice that comes when they start, their weight starts plateauing as well, or when they get to that weight maintenance, it's like an increase in anxiety again of, am I going to be able to maintain this weight loss, which potentially also comes from like a history of dieting and then having weight regain as well. So yeah, I guess a lot of reassurance around how the surgery has helped with that sustainability of weight loss, but then also coaching around like the lifestyle change and maintaining kind of the good routine and habits, hopefully the patient's built in that time frame.
Absolutely. Yeah, because it does require really significant changes to diet and lifestyle. You know, I mean, the surgery helps with physical hunger and earlier satisfaction, but yeah, it does require a lot of changes as well, I suppose.
Yeah. We have had a few questions come in on our Instagram. So one of our patients or A patient has asked, do you hit stalls? How do you get through them?
Well, I'm not sure for you, Max.
Yes, definitely all patients will have stalls, and whether that is looking like a weight stall of, 3 days because they're weighing themselves too regularly, or like, potentially, even a 4-week weight stall. So that is something that can happen without any change to diet or lifestyle, and that's just the journey of the weight loss surgery and how all the hormonal changes like Michael was talking about before. So I definitely try and coach my patients at the time to expect that, so it's not like a shock or something to be concerned about, and it's kind of always thinking about weight over a trend of time as well. So you're not going to see changes to body fat in looking at a daily weight. It's just not possible. You're looking at fluid fluctuations if you're weighing yourself that frequently.
Yeah, absolutely. And they might even see it going up and down a little bit, and that can be quite stressful, particularly in those first couple of weeks when there might still be that doubt in their mind that, is this going to work for me? I'm actually retaining a bit of fluid after surgery, and I don't even ask people in the first couple of weeks what they've weighed. Exactly, about the overall trend.
Exactly, yeah. So definitely I always try and get my patients to only weigh once a week maximum.
Easier said than done.
Yeah, and it takes a bit of time, but most people eventually get to a point that they do understand they're not going to see that trend, although the weight change as frequently the further away they get from surgery as well.
I think that's it's really interesting because, when you gain weight, you definitely don't gain weight every day either.
Yeah.
So you gain a little bit of weight, and you have a period where it's the same, and it's the same coming down. And I think that does also emphasise the point that this is not about calories, because probably most people after surgery have a very similar caloric intake day on day, and probably a pretty similar energy expenditure, with some variation. But actually, you do see these even, weeks stalls, which kind of shows, or it also supports the fact that it's the body trying to get to a healthy level rather than you measuring or working on a calorie deficit. And it's, all this stuff is so obvious when you think about it, but hidden as well.
Yeah. Most of the time, it's not anything we're necessarily doing or the patient's doing to their diet. So it's more just trusting the process is what I always say to people.
It's a long day.
Yeah.
Absolutely.
Yeah. Another question, a bit more around exercise. How soon after surgery can we go back to gym F45?
Yeah, probably about a month after surgery. That's really great. F45 is an excellent thing to do, that combination of the strength and cardio-based exercise. Fantastic. So obviously waiting for your surgeon's approval, but generally that's about a month after surgery, and in fact we really encourage it.
So it's mainly about strength these days, isn't it? Sort of been a bit of a shift from maybe 20 years ago where the emphasis was on cardiorespiratory exercise, but now we really focus on strength. And I think in the weight loss surgery group, that's probably doubly important. You are losing a little bit of muscle as your weight comes down, and that's kind of unavoidable whether you do surgery, medication, whatever. Muscle comes with the weight. So if you can keep that muscle, acknowledging that most people who carry a lot of weight actually are quite strong, if you can keep that muscle, then health outcomes are much improved.
Absolutely. And we do often find, particularly our bigger guys with a higher starting weight, very, very quickly they find they can lose strength. So something to get onto pretty early.
Yeah. Another question on our Instagram. So after year 2, I've hit a stall. I want to be 140, but I've stalled at 155, 166. What changes can I make to continue to lose weight after 2 years? It's a big question.
That's a big question.
I think, always in this situation, we always want you to go back to your team. If that is us, or if you don't have a team, then definitely feel free to contact our rooms. Because it is obviously probably a conversation you have to have one-on-one, whether you're looking at changes to your diet, potential consideration of medical therapy, depending on your medical history, and if that's something you're interested in. But yeah, that would be the starting point, I would say.
Yeah. I mean, obviously we don't know what your starting weight was, but I mean, you want to look at it holistically, and some people even would need to consider revision surgery or doing something to the surgery to optimise that outcome, but that's a complex discussion. Obviously, in general, the normal health recommendations always apply, Mediterranean style diet, reasonable portion size, as much fruit and veg as possible.
Yeah.
But yeah, we would sort of discuss that with people individually when we try and find the right way.
Yeah, exactly. Like I guess as a generalised advice, like kind of going back to basics with eating pattern is always a good way to think about it. Like kind of having the regular meals, are you having a source of protein in your meals, are you monitoring portion size, adding fruit, adding veg. So kind of that's a good place to start, but to get personalised support then you definitely want to have an appointment.
Yeah.
Actually, that makes me think of the fact that it's good to sort of recognise, and I think we need to talk about the fact that obesity is sort of I guess like a chronic condition, like blood pressure or diabetes, and some people have surgery, probably half, and then it sort of seems to treat the obesity and the obesity goes away, but most people actually find that it needs a little bit of maintenance, just in the same way that high blood pressure would, or high cholesterol, something to think about, just a little bit, unfortunately, forever.
Yeah, absolutely.
Yeah.
Not everyone can be one and done.
Exactly. Yeah, it's always like thinking about like maintenance of your lifestyle ongoing from a diet perspective, but then also knowing that obesity is a chronic health disease and needs potential multiple supports. So that's all our questions for now. What else haven't we covered on weight loss?
We're going to talk about revision surgery, weren't we?
Yeah.
So I guess we're now seeing more and more people, as time goes on, that are sort of asking for or looking at or discussing revision surgery, and I guess that's a real thing. The most common situation in Australia is gastric band to something else surgery, and many people know weight loss surgery as gastric banding, that was sort of the common term in the early 2000s, and Australia actually was one of the highest per capita places in the world for gastric banding.
Yeah, right.
So there's heaps of people with gastric bands in Victoria. A lot of them are really successful and doing really well, but sometimes the gastric band does run out of power or give really kind of bad quality of life symptoms after a time. So those people sometimes consider weight loss revision. And I guess the other one is if you've got symptoms or weight regain after one of the newer operations like a bypass or a sleeve. What do you guys think about the revision stuff?
I think that it's probably a bit more unpredictable in terms of estimated weight loss after these type of surgeries. And it's definitely an added variable there. And I think we were talking earlier today about how oftentimes after a primary surgery people get a real shock and awe feeling when they first start to eat and go, oh goodness, it feels quite tight, quite restrictive, quite uncomfortable, and they just don't seem to have that same feeling there. And that's not necessarily a bad thing, because we know it's more to do about the hormonal changes, but it's just kind of coaching them through and saying, hey, this is normal not to have such an intense feeling. Every single person, that feeling is going to reduce anyway, but we've probably just got to be even more mindful with portions and diet, and not rely on it.
It's just
definitely different.
Yeah. I think I notice more that their revision patients can probably tolerate a bigger portion size earlier, or feel like they need a bigger portion to be satisfied, and it's more exactly just like having the conversation and the understanding of like still applying the same principles to like the meal choices and understanding hunger and satiety and those conversations, but it just it means there's more variation with like the weight loss trajectory in those patients.
And we do see a lot of patients having a revisional surgery because of symptoms like really intense reflux that is having a really significant impact on their life, and their relief afterwards, they go, oh my goodness, this is so much better.
So I guess that's another one. It's just really about sort of tailoring the journey and
why they're having the surgery.
engaging with each individual in the team.
Okay. It's probably our main points for today that we wanted to cover. But yes, hopefully that was something you guys found interesting. Feel free to give us any suggestions for topics in the future that you want us to discuss. Definitely open for ideas.
Yeah.
Yeah, but thank you.
We'll see you in a fortnight.
Yeah, see ya.